Hey cat people, let's talk about your cat's eyes, not just for their beauty, but as a window into their health. Those eyes can reveal happiness, fear, and even illness. They're not just soulful, they're a health barometer. If you notice watery eyes, squinting, or anything unusual, don't ignore it. These subtle cues are your cat's way of communicating. Early recognition of eye issues can make a huge difference. This isn't about panic, it's about being empowered and informed. We'll cover what eye infections look like, what causes them, and what you can do. Think of this as your field guide to feline eye health. By learning the basics, you'll be ready to act and protect your cat. Your vigilance is a powerful tool. Let's dive in and make sure those beautiful eyes stay healthy and expressive. Because being a great cat guardian starts with being observant. Let's talk cat eye infections, a simple breakdown. We all adore our feline friends, and their eyes are one of their most captivating features. But what happens when those beautiful eyes become red, swollen, or start to discharge? It could be a sign of an eye infection, and understanding what that entails is crucial for every cat owner. A cat eye infection is essentially when the delicate tissues surrounding your cat's eye become inflamed and irritated, usually by pesky germs like bacteria or viruses. Think of it as a tiny battleground where your cat's body is fighting off an unwelcome invasion. The most common type of eye infection you'll encounter is conjunctivitis, often referred to as pink eye. It's similar to what humans experience, and it's a frequent reason for vet visits. Conjunctivitis is essentially an inflammation of the conjunctiva, which is the membrane lining the inner eyelids and covering part of the eyeball. This membrane acts as a protective barrier, and when it gets inflamed, it's a clear sign something is amiss. It's the eye's first line of defense against the outside world, and when it's irritated, you'll typically see redness in the whites of the eye and around the eyelids. This redness is a key indicator that something isn't right. You'll also likely notice swelling. Exposure to other animals, environments, and even just dust and allergens can trigger an infection. Ultimately, the infection is a battle between your cat's own immune system, which is trying to keep things in balance, and the invading bacteria or viruses that are attempting to colonize the eye area. Symptoms like redness in the eye, swelling of the eyelids and surrounding tissues, and discharge, which can range from clear and watery to thick and pus-like, are the eye's way of asking for help. They're signals that something is wrong and needs attention. Sometimes an eye infection isn't just a localized problem, it's a sign of a bigger issue brewing within your cat's body, like an upper respiratory infection, which often presents with both nasal and eye discharge. That's precisely why you can't simply ignore it or hope it magically goes away on its own. Delaying treatment can lead to more serious complications and prolonged discomfort for your beloved pet. The eye is telling a story. It's your job to listen carefully to what it's trying to communicate. Those subtle changes in appearance and behavior are clues that can help you understand what your cat is experiencing. Recognizing the problem, acknowledging the symptoms, and understanding the potential underlying causes is the crucial first step to helping your cat get back to their happy, healthy selves. Early intervention is key. All right, let's put on our detective hats and delve into the world of feline eye infections. We need to understand who the usual suspects are. What are the main causes that lead to these pesky problems? First up, viruses are often the top cause of eye infections in cats. They're masters of disguise and can easily infiltrate a cat's system. One of the most common viral culprits is especially feline herpes virus, often abbreviated as FHV1. This virus is a major player in feline upper respiratory infections, which frequently manifest as eye problems. The tricky thing about FHV1 is that once a cat is infected, the virus stays in their system for life. It can lie dormant for long periods and then flare up when the cat is stressed or immunocompromised. These flare-ups often present as conjunctivitis or other eye issues. Feline calicivirus is another viral troublemaker that we need to be aware of. Like herpes virus, it's a common cause of upper respiratory infections in cats, and it can also lead to eye infections. Now, what often happens is that bacterial infections follow the viral ones, taking advantage of weakened defenses. When a cat's immune system is already fighting off a virus, it becomes more susceptible to bacterial invaders. When we talk about bacterial infections, think chlamydia. This is a common bacterial infection that can cause conjunctivitis in cats, leading to inflammation and discharge from the eyes. Another bacterial culprit to consider is mycoplasma. This is a type of bacteria that can also cause conjunctivitis and other eye problems in cats. It's easy to overlook, But even a tiny scratch on the eye or eyelid can let bacteria in and cause a full-blown infection. Cats are curious creatures, and they can easily get minor injuries while exploring their environment. Beyond infections, allergens and irritants like dust, cleaning chemicals, and other environmental factors can also play a significant role in feline eye problems. Things like smoke, pollen, and even certain types of cat litter can irritate a cat's eyes and lead to inflammation and discomfort. These allergens and irritants can trigger a range of eye problems, from mild redness and watering to more severe inflammation and discharge. While these irritants are not infections themselves, they can lead to irritation and secondary bacterial infections if the cat scratches or rubs its eyes excessively. Physical injuries to the eye are also a common cause of problems. This includes scratches, pokes from sharp objects, or debris getting lodged in the eye. These types of injuries are especially common in multi-cat homes, where cats may engage in rough play, or for outdoor explorers who encounter various hazards in their environment. Remember, even a small injury can quickly become a big problem if bacteria get in and cause an infection. That's why it's so important to check your cat carefully after any scuffle with another animal, or after they've been exploring outdoors. Look for any signs of injury or irritation. Ultimately, prevention starts with understanding these potential risks and taking steps to minimize them. One of the best things you can do is keep your cat's environment clean and safe, reducing their exposure to allergens, irritants, and potential hazards. And always watch for any signs of eye problems after any incident, no matter how minor it may seem. Early detection is key to preventing serious complications. Remember, quick action and a visit to the vet can often prevent a minor issue from becoming a serious and potentially sight-threatening problem. As a cat owner, you're your feline friend's first line of defense when it comes to their health. One of the most common issues cats face is eye infections. But how do you know if your cat's adorable peepers are harboring a problem? What should you look for? Here's what stands out. We're going to walk you through the key signs and symptoms that indicate your cat might be battling an eye infection. Recognizing these early can make all the difference in getting them the treatment they need quickly and effectively. Excessive tearing or watery eyes. This is often one of the first and most noticeable signs, especially if it's new or persistent. A little bit of tearing can be normal, but if you notice a constant stream, or if it lasts for more than a day or two, it's definitely worth investigating further. Redness and swelling. Take a close look at the tissues around your cat's eyes, of the eyelids or the pink tissue inside, also known as the conjunctiva. If these areas appear inflamed or unusually red, it's a strong indicator of an infection or irritation. Puffy eyelids. Swelling can also manifest as puffiness around the eyes, or a partially closed eye signal inflammation. This squinting is a protective mechanism, as your cat tries to shield their eye from further discomfort. Discharge that starts clear. Initially, the discharge might appear clear and watery, but turns yellow or green is a big red flag. This change in color indicates that the infection is likely bacterial and requires veterinary attention. Goopy buildup in the corners. Keep an eye out for any unusual accumulation of discharge, especially if it's thick or sticky. Or crust on the eyelids means it's time for a vet visit. This crusting can be quite uncomfortable for your cat and can even make it difficult for them to open their eyes. Watch your cat's behavior. Changes in their usual habits can be a subtle but important clue. Squinting, holding an eye shut, these are clear signs of discomfort. Pawing at their face or rubbing against furniture. They might be trying to relieve the itching or pain associated with the infection. Excessive blinking or trouble keeping the eye open, these can also indicate irritation or pain, are also warning signs. Any deviation from their normal eye behavior warrants a closer look. These actions show your cat is uncomfortable or in pain. It's their way of communicating that something isn't right. Cats can't say "my eye hurts," so we need to be observant and interpret their nonverbal cues. But their actions speak volumes. Pay attention to the subtle changes in their behavior, as these can be early indicators of an eye problem. Trust your instincts. You know your cat best. If something looks off, it probably is. Don't hesitate to seek professional help if you have any concerns about your cat's eye health. Early detection is key to preventing complications. The sooner you identify a potential problem, the easier it will be to treat and the less likely it is to cause long-term damage. Don't wait. Get your cat checked if you notice these signs. A quick trip to the vet can provide a diagnosis and treatment plan, ensuring your feline friend's eyes stay healthy and happy. Prevention is always better than treatment. Keep your home clean, Vacuum and dust regularly to reduce irritants. Avoid using aerosols or harsh chemicals near your cat. Stay up to date on vaccinations and schedule regular vet checkups. In multi-cat homes, reduce stress by providing enough resources and space for everyone. Quarantine new cats before introducing them to your household. If a cat gets sick, separate them to prevent spreading infection. Wash your hands after handling a sick cat. Good nutrition and a low-stress environment build a strong immune system. A healthy home means healthy eyes. Suspect an eye infection? Call your vet first. Never use leftover or human medications. Cat eyes are delicate. Your vet will diagnose the cause and prescribe the right treatment. Bacterial infections get antibiotics. Viral ones may need antivirals or supplements. Allergies or injuries require specific care, sometimes even surgery. Follow your vet's instructions exactly. Finish all medication and attend follow-ups. Early and proper treatment is crucial for recovery. You're a vital part of your cat's healthcare team. Some symptoms are true emergencies. Severe pain, eye held shut, crying, or frantic pawing means get to the vet now. Cloudy, hazy, or bluish cornea, blood in the eye, or abnormal pupil shape are urgent. Thick, green, yellow, or bloody discharge signals a severe infection. Eye symptoms plus lethargy, loss of appetite, or breathing trouble mean a bigger problem. Any trauma or suspected foreign object in the eye is an emergency. Don't try to treat it yourself. Get professional help fast. With eyes, every minute counts. Quick action can save your cat's vision. Your cat's eyes reflect their overall health. Eye infections can signal deeper issues. Think of them as a check engine light. Recurrent problems often point to stress or a weak immune system. Look at your cat's environment, diet, and emotional well-being. Dental issues or systemic diseases like FIV or FELV can also show up as eye problems. High blood pressure in older cats can cause sudden eye changes. That's why your vet looks at the whole cat, not just the eyes. A holistic approach leads to better health and fewer flare-ups. Connect the dots between symptoms, lifestyle, and wellness. True care means seeing the bigger picture. We've covered what eye infections are, how to spot them, and what to do. But it all comes down to your relationship with your cat. You know their routines and quirks, use that knowledge. Your vigilance is an act of love. Don't worry about overreacting. Small changes matter. Trust your gut if something feels off. Act on it. You are your cat's advocate and protector. Educating yourself empowers you to be the best guardian. This isn't about being a vet, it's about being observant and caring. Keeping your cat's eyes healthy is part of a bigger journey. Watch, learn, and love your cat will thank you. Stay vigilant and act early for a long, happy life together. You've got... Hey cat people, welcome back to the channel. Today we're tackling a topic that worries every cat guardian: eye infections. When your cat's eyes look red, watery, or painful, it's a sign their world isn't right. But you're their first line of defense. In this video, we'll show you how to spot the signs and give you 7 essential home fixes to help your cat feel better. This is about restoring their comfort and that clear, loving gaze. Let's get their mojo back. Together, let's get into it. Let's become cat detectives. We're going to learn how to decipher the subtle signals your feline friend might be sending you, especially when it comes to their precious eyes. It's a journey of observation, understanding, and ultimately, providing the best possible care for your beloved companion. Think of it as unlocking a secret language, a way to understand their needs even when they can't explicitly tell you. Your cat can't tell you their eye hurts. They can't verbalize the discomfort or explain the blurry vision they might be experiencing. They rely on you, their attentive human, to notice the changes and interpret their behavior. Imagine the frustration of not being able to communicate when something is wrong. That's why it's so important to become fluent in cat speak, particularly when it comes to their health. So you need to read the signs. You need to become a keen observer of their daily habits, their facial expressions, and any subtle shifts in their demeanor. Are they blinking more than usual? Are they avoiding bright light? These seemingly small details can be crucial pieces of the puzzle. It's about paying attention to the nuances of their behavior and recognizing when something is amiss. First, look for unusual discharge. This is often one of the most obvious indicators that something isn't right. A healthy cat's eyes should be clear and bright, free from any excessive moisture or buildup. Persistent watery eyes or thick yellow-green goo. Watery eyes might indicate allergies or a mild irritation, but thick, colored discharge is a strong sign of infection. Don't ignore even a small amount of unusual discharge. It's always best to err on the side of caution. Note the color and consistency, as this information will be helpful for your veterinarian. Next, Check for redness and swelling. Inflammation around the eye is another key indicator of a potential problem. In the whites or around the eye. The whites of the eyes should be clear and white. Redness in this area suggests inflammation or irritation. Also, gently examine the area around the eye for any swelling or puffiness. Even subtle swelling can be a sign of an underlying issue, squinting or hiding from light. This is a common sign of discomfort and light sensitivity. That's a sign of pain. Light sensitivity, also known as photophobia, can be a symptom of various eye problems, including corneal ulcers or inflammation. If your cat is suddenly avoiding brightly lit areas or squinting excessively, it's important to investigate further. Watch for pawing or rubbing at the eye. This is a natural instinct for a cat trying to relieve discomfort. This can make things worse. While it might seem like they're just trying to clean their face, excessive pawing or rubbing can further irritate the eye and potentially cause more damage. It's crucial to prevent them from doing this if possible, until you can get them checked by a vet. These behaviors are your cat's way of saying, "Help me." They are communicating their distress in the only way they know how. Early detection is key. The sooner you identify a problem, the better the chances of a successful outcome. It can mean the difference between a minor issue, easily treated with medication or simple home care, and a major problem. Untreated eye infections can lead to serious complications, including vision loss. A cat with an eye infection feels vulnerable and less confident. They may become withdrawn, less playful, and more prone to hiding. Restoring their health restores their sense of security. When their eyes are healthy and comfortable, they can confidently explore their environment and interact with you without fear or discomfort. So, remember, these key signs are your guide to understanding your cat's eye health. Discharge, redness, these are the visual cues that demand your attention. Squinting and pawing, these are the behavioral signals that indicate discomfort and pain. Are your main clues? By paying close attention to these signs, you can proactively protect your cat's vision and overall well-being. Spot one or more, and it's time to act. Don't hesitate to contact your veterinarian for a professional diagnosis and treatment plan. Now let's talk about the first step to relief. We'll explore some gentle home care techniques you can use while waiting for your vet appointment to help soothe your cat's discomfort. You've spotted the symptoms, the telltale signs of irritation or infection in your cat's eyes. Perhaps you've noticed excessive tearing, a discharge that's not quite right, or even some redness around the eye area. These are all signals that something needs attention. Now, before we jump to conclusions or reach for any random remedy, let's focus on providing some immediate relief and cleaning the affected area. This initial step is crucial, not only for your cat's comfort, but also to prevent any further complications. When it comes to cleaning your cat's delicate eyes, the choice of solution is paramount. Always use only sterile saline solution. This is the golden rule of feline eye care. Sterile saline is specifically formulated to be gentle and compatible with the sensitive tissues around the eye. It's a simple salt and water solution, but its sterility is what makes it safe and effective for flushing out irritants and debris. On the other hand, what you should absolutely avoid are harsh chemicals or soaps. These substances, while effective for cleaning other things, are far too aggressive for your cat's eyes. They can cause severe irritation, burning sensations, and even long-term damage to the cornea. Remember, your cat's eyes are much more sensitive than your own, so what might seem mild to you could be incredibly painful for them. Saline is gentle, pH balanced, meaning it closely matches the natural pH of your cat's tears. This is incredibly important because it ensures that the solution won't disrupt the delicate balance of the eye's ecosystem. A pH-balanced solution will minimize discomfort and prevent further irritation, making the cleaning process much more pleasant for your feline friend. And most importantly, saline is safe for your cat's sensitive eyes. You can use it with confidence, knowing that you're not introducing any harmful substances that could exacerbate the problem. It's the go-to solution recommended by veterinarians for routine eye cleaning and addressing minor irritations. Now, before you start, let's talk about technique. Wrap your cat in a towel, employing what's affectionately known as the kitty burrito, to keep them calm and safe. This method involves gently but firmly wrapping the towel around your cat's body, leaving only their head exposed. This helps to minimize their movement, prevent scratching, and reduce stress for both of you. Next, grab your supplies. Use a clean cotton ball or a sterile gauze pad dampened with saline. Make sure the cotton ball or gauze is thoroughly moistened but not dripping wet. Excess liquid could run into your cat's ear or down their face, causing further discomfort. With your prepared cotton ball or gauze pad, gently wipe away from the corner of the eye, always moving outwards. This direction is crucial because it helps to prevent any debris or discharge from being pushed back into the eye, which could worsen the irritation. To maintain hygiene and prevent cross-contamination, use one swipe per pad. This means that after each gentle wipe, you should discard the used cotton ball or gauze pad and grab a fresh one. This simple step significantly reduces the risk of spreading bacteria or irritants back into the eye. When cleaning, it's important to be gentle. Don't rub or reuse pads. Rubbing can further irritate the delicate skin around the eye and potentially damage the cornea. Reusing pads defeats the purpose of cleaning, as you'll simply be transferring the same debris and bacteria back onto the eye. By using a fresh pad for each swipe and avoiding rubbing, you prevent further irritation and the potential spread of bacteria. This is especially important if you suspect an infection, as you don't want to inadvertently introduce more pathogens into the area. The simple act of cleaning removes crusty discharge and helps your cat feel immediate relief. Imagine having something stuck in your eye. The discomfort and irritation can be overwhelming. By gently removing the discharge, you're providing your cat with much-needed comfort and allowing their eye to start healing. However, it's important to remember that not all cats are cooperative patients. Be patient. If your cat resists, don't force the issue. Forcing them can create negative associations with eye cleaning and make future attempts even more challenging. If your cat becomes agitated or stressed, take a break and try again later. Sometimes a little bit of time and a calmer approach can make all the difference. You can try distracting them with a toy or offering a small treat to create a more positive experience. Depending on the severity of the issue, you may need to repeat this process a few times a day if needed. Regular cleaning can help to keep the area free of debris and promote healing. However, if the condition doesn't improve or worsens, it's crucial to consult with your veterinarian. This simple step soothes irritation and sets the stage for healing. By keeping the area clean and free of irritants, you're creating an environment that's conducive to recovery. However, remember that cleaning is just one part of the equation. Remember, saline only, gentle wipes, and a calm approach. These are the key ingredients for successful and stress-free feline eye care. And of course, lots of love and patience. After cleaning, a warm compress is your next tool. Use a soft cloth dampened with lukewarm water. Test it on your wrist first. Gently hold the compress against your cat's closed eye for a few minutes. No pressure. Just let the warmth soothe and reduce swelling. This can help loosen stubborn discharge and even clear minor tear duct blockages. Repeat 2 or 3 times a day for best results. If your cat resists, don't force it. Keep the experience positive. The warmth increases blood flow and promotes healing. This simple act can make a big difference in your cat's comfort. Sometimes, despite our best efforts with gentle cleaning and warm compresses, these measures simply aren't enough to combat a stubborn eye infection. We might notice persistent discharge, excessive blinking, or continued redness, signaling that a more targeted approach is needed. It's at this point that we need to consider additional medical intervention to provide our feline friend with the relief they deserve. Remember, early intervention is crucial to prevent further discomfort and potential complications. In these situations, medicated eye drops or ointments may be needed to directly address the underlying cause of the infection. These medications often contain antibiotics or anti-inflammatory agents designed to target the specific type of infection affecting your cat's eye. Eye drops are generally easier to administer and are quickly absorbed, while ointments provide a longer-lasting effect, coating the eye and providing sustained relief. However, and this is a crucial point, always consult your vet first before administering any medication to your cat, even over-the-counter options. Self-treating can be dangerous and potentially worsen the condition. Your veterinarian is the best resource for diagnosing the specific issue and recommending the appropriate course of treatment. Not all eye infections are the same. They can be caused by bacteria, viruses, fungi, or even allergies. The wrong medication can not only be ineffective, but can also do harm, potentially leading to antibiotic resistance or exacerbating the existing condition. Using the wrong medication could also mask the symptoms, delaying proper diagnosis and treatment of a more serious underlying issue. After a thorough examination, your vet will be able to accurately diagnose the type of infection and recommend the right product and dosage specifically tailored to your cat's needs. They will consider factors such as your cat's age, weight, overall health, and any other medications they may be taking to ensure the chosen treatment is both safe and effective. When it comes time to apply the medication, gently secure your cat in a towel to prevent scratching or struggling. This cat burrito technique helps to keep them calm and still, making the process much easier and safer for both you and your feline companion. Once your cat is secure, gently tilt their head back slightly, and with your non-dominant hand, carefully open the lower eyelid to create a small pouch. With your dominant hand, hold the eye drop bottle or ointment tube close to the eye and gently apply the prescribed amount of drops or ointment into the pouch you've created. Never touch the eye directly with the applicator tip to avoid contamination or injury. After applying the medication, release the eyelid and allow your cat to blink naturally. This blinking action will help to spread the medicine evenly across the surface of the eye, ensuring maximum coverage and effectiveness. Immediately follow up with plenty of treats and verbal praise to make it a positive experience for your cat. This positive reinforcement will help them associate the treatment with something good, making future applications much easier and less stressful. It's crucial to stick to the schedule your vet provides for administering the medication. Don't skip doses, even if your cat's eye appears to be improving, and don't stop the treatment early, even if the symptoms seem to have completely disappeared. Prematurely discontinuing medication can lead to a relapse or the development of resistant bacteria. In conclusion, seeking vet guidance, ensuring correct application techniques, and maintaining consistency with the prescribed treatment schedule are all key to achieving safe and effective treatment for your cat's eye infection, ultimately leading to a happier, healthier feline friend. If you have other pets, isolation is crucial. Many eye infections are highly contagious. Set up a quiet, comfortable space with separate food, water, litter box, and bedding. This prevents the spread of infection and gives your cat a peaceful place to heal. Wash your hands after caring for your sick cat to avoid spreading germs. Make the space cozy with favorite blankets and toys. Spend quality time with your cat so they don't feel abandoned. Isolation should last until your cat is fully recovered. Ask your vet for guidance. It's a loving, responsible step for your whole furry family. A clean environment is vital for recovery. Wash your cat's bedding in hot water with fragrance-free detergent, no fabric softeners. Switch to low-dust litter and scoop daily to reduce irritants. Avoid air fresheners, scented candles, and harsh cleaners. Go fragrance-free. Improve ventilation and vacuum with a HEPA filter to remove dust and allergens. Wipe surfaces with a damp cloth to trap particles. These steps reduce irritants and support healing. A clean, calm space helps prevent future flare-ups and keeps your cat healthier overall. Healing starts from the inside out. Feed your cat a high-quality, protein-rich diet. Avoid fillers like corn and soy. Hydration is key. Wet food or a water fountain can help. Ask your vet about supplements like L-lysine for viral infections and probiotics for gut health. Lower stress by keeping your cat's environment calm and predictable. Good nutrition, hydration, and low stress build a stronger immune system. This approach helps your cat recover now and stay resilient in the future. There you have it, 7 practical ways to help your cat with an eye infection. From spotting the signs to cleaning compresses and boosting their immune system, you're now ready to be your cat's best advocate. Your calm, gentle care makes all the difference. If things don't improve or seem severe, always call your vet. Thanks for watching and for being a dedicated cat guardian. If you found this helpful, give us a thumbs up, share your experiences below, and subscribe for more cat care tips. Until next time, keep building that bond with your cat. Welcome. As a veterinarian, I often see cat owners worried about their pet's eyes. Today, we'll break down the key signs that mean it's time to take your cat to the vet for an eye infection. Let's get started. As a cat owner, you're your feline friend's first line of defense when it comes to their health. One of the most important things you can do is to regularly observe your cat, paying close attention to any changes in their behavior or physical appearance. This is especially true when it comes to their eyes. A healthy cat's eyes are a window to their overall well-being, and any abnormalities can be an early indicator of an underlying issue. So what does a healthy cat eye look like? Bright, clear, fully open, and alert. A healthy cat's eyes should be free of any cloudiness, discharge, or excessive tearing. They should be wide and expressive, reflecting their curiosity and engagement with the world around them. When your cat is relaxed and comfortable, their eyes will be fully open, taking in all the sights and sounds of their environment. With white sclera and pale pink conjunctiva, The sclera, or the white part of the eye, should be a clear, bright white, free from any redness or discoloration. The conjunctiva, which is the thin membrane that lines the inside of the eyelids and covers the white part of the eye, should be a pale pink color. Any deviation from these colors could indicate inflammation or infection. A little clear tearing or dark crust after a nap is normal. It's simply part of their natural eye cleaning process. Just like humans, cats produce tears to keep their eyes lubricated and free from debris. These tears can sometimes accumulate in the corners of their eyes, especially after a long nap. Think of it as sleep in their eyes. This sleep, or normal eye discharge, is usually a small amount of dark, crusty material that can be easily wiped away with a damp cloth. It's nothing to be concerned about, and it's a sign that your cat's eyes are functioning properly. But if you notice persistent discharge, that's a warning sign. Unlike the occasional sleep in their eyes, persistent discharge is a continuous flow of fluid from the eye that doesn't seem to go away. This could be a sign of an underlying eye infection or other health problem that needs to be addressed by a veterinarian. Discharge can be clear and watery, resembling tears that are constantly overflowing from the eye. This type of discharge is often associated with allergies, irritants, or early stages of an eye infection. You might notice tear stains forming on the fur around your cat's eyes, especially in light-colored cats, or become thick, like mucus or pus. Thick discharge, on the other hand, is a more serious sign of infection. It can be yellow, green, or even brown in color, and it often has a sticky or pasty consistency. This type of discharge is usually caused by bacteria or viruses, and it requires prompt veterinary treatment. Redness or swelling of the eyelid or conjunctiva is another red flag. The eyelids may appear puffy or inflamed, and the conjunctiva may be bright red and irritated. This is a clear indication that something is wrong with your cat's eye, and it's important to seek veterinary attention as soon as possible. This could mean conjunctivitis, a common part of many eye infections. Conjunctivitis, also known as pink eye, is an inflammation of the conjunctiva. It can be caused by a variety of factors, including bacteria, viruses, allergies, and irritants. In addition to redness and swelling, conjunctivitis can also cause discharge, excessive tearing, and squinting. If your cat is squinting or blinking excessively, pay attention. This is a telltale sign that something is amiss and warrants a closer look. Squinting and excessive blinking are often signs of discomfort or pain in the eye. Your cat may be trying to protect their eye from light or to relieve irritation. This is a sign of pain. The pain could be caused by a foreign object in the eye, a scratch on the cornea, or an underlying eye infection. It's important to determine the cause of the pain so that your cat can receive appropriate treatment. Persistent squinting, called blepharospasm, means your cat is uncomfortable and is a more pronounced and concerning symptom. Blepharospasm is the involuntary contraction of the muscles around the eye, causing the eyelids to clamp shut. This is a clear indication that your cat is experiencing significant pain or irritation in their eye. Cats may paw at their face or rub against furniture to relieve irritation. This is a natural instinct for cats, as they try to alleviate the discomfort they're feeling in their eye. However, this behavior can sometimes do more harm than good. This behavior can actually make things worse, as their paws may carry bacteria or debris that can further irritate the eye. Additionally, the act of pawing or rubbing can cause further damage to the cornea, potentially scratching the cornea. The cornea is the clear, protective outer layer of the eye. Scratches or abrasions on the cornea can be very painful and can lead to serious eye problems if left untreated. Watch for a combination of discharge, redness, squinting, and pawing. The presence of multiple symptoms is a strong indicator that your cat has an eye infection or other eye problem that requires veterinary attention. Don't wait for the symptoms to worsen before seeking help. These are your main indicators that something's wrong, and it's crucial to act quickly to protect your cat's vision and overall health. By being vigilant and observant, you can catch eye problems early and ensure that your cat receives the best possible care. Early recognition is key to preventing complications, as many eye conditions can worsen rapidly if left untreated. Prompt veterinary care can help to prevent permanent damage to your cat's eye and can improve their chances of a full recovery. If you see these signs, it's time to pay close attention and monitor your cat's eyes even more carefully. Note the frequency and severity of the symptoms and be prepared to provide your veterinarian with a detailed description of what you've observed. Let's look at what specific symptoms mean in more detail, so you can be even more prepared to discuss your concerns with your vet and get your feline friend on the road to recovery. Remember, your proactive involvement is essential for maintaining your cat's eye health and overall well-being. If your cat's eyes are constantly weeping, especially for more than a day, take note. Clear discharge can be minor, but thick, yellow or green pus is a major warning sign. This colored discharge usually means a bacterial infection is present. At this point, home care won't solve the problem. Wiping away pus won't stop the infection. It will keep coming back. Left untreated, the infection can worsen and damage the eye. If you see thick colored discharge, call your vet right away. Your vet will likely prescribe antibiotic eye drops or ointment. Don't use human medications. These can harm your cat. A proper diagnosis and treatment are essential. Intense redness and swelling around your cat's eye is a clear sign that something isn't right. It's more than just a minor irritation. It indicates a problem that needs your immediate attention. The degree of redness and swelling can vary, but any noticeable change from the normal appearance of your cat's eye warrants a closer look. Eye inflammation that persists for more than a day or two, or redness that simply doesn't improve despite your best efforts to provide comfort, is a serious cause for concern. It suggests that the underlying issue is not resolving on its own and may require veterinary intervention. Don't assume it's just a temporary issue. Persistent inflammation can lead to more significant complications if left untreated. Observing your cat's eye and noticing these symptoms is a serious concern that should prompt you to seek professional veterinary advice. As a responsible pet owner, it's crucial to recognize when a problem is beyond your ability to manage at home. Early detection and intervention are key to preventing further damage and ensuring your cat's well-being. If the whites of the eyes, also known as the sclera, are bloodshot, it indicates inflammation or irritation within the eye. This bloodshot appearance is due to the dilation of blood vessels in the sclera, a sign that the eye is actively responding to some form of stress or injury. If the conjunctiva, the clear membrane that covers the white part of the eye and the inner surface of the eyelids, is bulging or swollen, this is a clear indication of significant inflammation or fluid accumulation. This condition, known as chemosis, can be quite alarming in appearance and is a sign that the eye is under considerable stress. When the inflammation is severe, it's not just a mild redness or slight swelling. It's a pronounced and obvious reaction that can affect the entire eye area. The eye may appear significantly larger than normal, and the surrounding tissues may be hot to the touch. This level of inflammation could be a result of a strong infection, where bacteria, viruses, or fungi have invaded the eye tissues, causing a rapid and intense inflammatory response. Infections can quickly escalate and cause significant damage if not treated promptly. A common culprit behind eye infections in cats is feline herpes virus, but trauma, such as a scratch or blunt force injury, can also lead to severe inflammation. Trauma can damage the delicate structures of the eye, triggering an inflammatory cascade as the body attempts to heal the injury. Swelling and redness in and around the eye can also indicate a scratch on the cornea, a foreign object lodged in the eye, or some other form of injury to the delicate tissues. Even a tiny scratch can cause significant discomfort and inflammation, while a foreign object can introduce bacteria and lead to infection. As a first step, gently clean the affected area with sterile saline solution to remove any debris or discharge that may be contributing to the irritation. Use a soft, clean cloth or cotton ball to gently wipe around the eye, being careful not to apply too much pressure. After cleaning, take a closer look at the eye to assess the extent of the damage and identify any potential foreign objects. Pay attention to the color of the eye, the presence of any discharge, and the overall appearance of the surrounding tissues. However, if the swelling and redness persist despite your efforts to clean the area, or if the condition appears to be worsening over time, it's crucial to seek professional veterinary care. A worsening condition indicates that the underlying problem is not resolving on its own and may require more aggressive treatment. In such cases, it's essential to see your veterinarian immediately to get an accurate diagnosis and appropriate treatment plan. Delaying treatment can lead to more serious complications and potentially irreversible damage to your cat's eye. During the examination, the vet may use special stains, such as fluorescein stain, to check for corneal ulcers or other damage to the surface of the eye. This stain highlights any areas where the cornea has been compromised, allowing the vet to assess the extent of the injury. The vet may also flush the eye with sterile saline to remove any remaining debris and to further examine the eye for any hidden injuries or foreign objects. Flushing helps to clear the field of vision and allows the vet to get a better look at the underlying tissues. Depending on the diagnosis, Treatment could include antibiotics to combat infection and anti-inflammatory drops to reduce swelling and discomfort. The specific medications and dosage will depend on the underlying cause of the inflammation and the severity of the condition. Ignoring severe swelling and redness in your cat's eye is never a good idea, as it can have serious consequences for their vision and overall health. Untreated inflammation can lead to a cascade of problems that can be difficult to reverse. Prolonged inflammation can lead to vision problems, including blurred vision, decreased visual acuity, or even permanent damage to the eye structures, potentially resulting in blindness. The longer the inflammation persists, the greater the risk of irreversible damage. So don't wait and delay seeking treatment. It's crucial to get professional help from a qualified veterinarian if you observe these concerning signs in your cat's eyes. Early intervention can make all the difference in preserving your cat's vision and ensuring their long-term well-being. Persistent squinting or hiding from light means your cat is in pain. This often signals a corneal ulcer, a painful sore on the eye's surface. Corneal ulcers can be caused by scratches, infection, or excessive rubbing. Cats with ulcers may hide in dark places to avoid light. This is an emergency. There's no home remedy for a corneal ulcer. Your vet will use a fluorescein stain to check for ulcers. Prompt treatment is critical to prevent rupture or vision loss. Treatment usually involves antibiotics and pain relief. Severe cases may need surgery. If your cat is squinting or light sensitive, see your vet right away. As a cat owner, you're finely attuned to your feline friends' habits and behaviors. You know when they're feeling playful, when they're feeling cuddly, and when something just isn't quite right. Subtle shifts in their demeanor can be early warning signs of underlying health issues. If your cat becomes lethargic, noticeably more tired than usual, and seems to lack the energy they typically possess, it's a cause for concern. This isn't just about a lazy afternoon nap. It's a persistent state of low energy that deviates from their normal activity levels. Another significant behavioral change to watch out for is if your cat suddenly hides more frequently. While cats enjoy their alone time, excessive hiding, especially in unusual or dark places, can indicate that they're feeling unwell or stressed. They might retreat under furniture, seek refuge in closets, or hide in corners, avoiding interaction with you and other members of the household. This behavior is often a sign that they're trying to cope with discomfort or pain. Perhaps one of the most alarming signs is when your cat stops eating or displays a significant loss of appetite. A healthy cat typically has a good appetite and looks forward to mealtimes. If your cat suddenly turns their nose up at their favorite food, shows no interest in eating, or only nibbles at their food before walking away, the problem is serious. This could be indicative of a variety of underlying health issues, ranging from infections to dental problems. Eye infections can manifest in various ways, such as redness, swelling, discharge, or excessive blinking. These infections can make cats feel sick all over, impacting their overall well-being and energy levels. It's not just a localized issue. The discomfort and inflammation can affect their entire system. The discomfort from an eye infection can be quite significant, causing pain and irritation that extends beyond just the eye itself. This can lead to a decrease in appetite, lethargy, and a general reluctance to engage in their usual activities. Viruses like feline herpes virus are a common culprit behind eye infections in cats. This virus often causes both eye and upper respiratory issues, creating a double whammy of discomfort for your feline companion. In addition to eye problems, feline herpes virus can also trigger respiratory symptoms, such as sneezing, coughing, nasal congestion, and difficulty breathing. These symptoms can further contribute to a loss of appetite and overall malaise. Loss of appetite is especially concerning. It's a red flag that something is definitely amiss with your cat's health. It's crucial to identify the underlying cause and address it promptly. Cats rely heavily on their sense of smell to stimulate their appetite and enjoy their food. When they have nasal congestion due to a respiratory infection or other ailment, they can't smell their food properly, which can stop them from eating. It's like trying to enjoy a delicious meal when you have a stuffy nose. The flavors are muted, and the experience is far less appealing. Pain, regardless of its source, can significantly impact a cat's appetite and willingness to engage in playful activities. If your cat is experiencing pain, they may find it uncomfortable to eat, groom themselves, or even move around. This can lead to a decrease in appetite and a general disinterest in things they normally enjoy, making eating and playing less appealing. If your playful cat, who usually loves to chase toys and interact with you, is suddenly withdrawn, lethargic, and uninterested in their surroundings, or if they are skipping meals, it's a clear indication that something is wrong. This abrupt change in behavior warrants immediate attention. Don't delay seeking veterinary care. Act quickly to ensure your cat receives the necessary diagnosis and treatment. These changes, such as lethargy, hiding, and loss of appetite, often mean the infection or underlying illness is no longer localized and is now affecting their whole body, leading to a systemic illness. This can have serious consequences if left untreated. When it comes to your cat's health, time is of the essence. Don't wait more than half a day or even a few hours if you observe these symptoms. Prompt action can make a significant difference in their recovery. The vet will conduct a thorough examination to check for other underlying illnesses, perform diagnostic tests, and may provide supportive care, such as fluids or medication, to help your cat recover. They will companion. By seeking veterinary care promptly, you're giving your cat the best chance at regaining their health and vitality. Colored discharge, swelling, squinting, and behavior changes are all red flags. Don't ignore them. You are your cat's best advocate. Trust your instincts and act quickly. It's always better to be safe and get a vet's opinion than to risk your cat's health. Prompt care keeps your cat comfortable and prevents long-term problems. Thanks for watching. Give your cat some extra love. Hey, fellow cat guardians, I'm so glad you're here, ready to learn more about keeping your feline friends happy and healthy. I'm Dr. Emily Carter, and I've dedicated my career to understanding and caring for these amazing creatures. Today, let's talk about something that can make any cat lover anxious: the dreaded thought of something being wrong with your cat. Specifically, we're diving into eye infections. These can range from minor irritations to more serious conditions, and knowing what to look for is crucial. Your cat's eyes are a window to their health. They offer valuable insights into their overall well-being. Healthy, bright eyes are a sign of a happy cat. So when you see redness, that's your first clue that something might be amiss. It could indicate inflammation or irritation, or discharge, whether it's clear, cloudy, or colored. It's definitely a sign that the eye is trying to fight something off. Or squinting, which is often an indication of pain or discomfort. Cats tend to hide their pain, so squinting is a pretty clear signal they're not feeling their best. Any of these signs, even if they seem minor, it's a sign something's off and warrants a closer look. As their guardian, you're their first line of defense. You know your cat best, and you're most likely to notice subtle changes in their behavior or appearance. My goal is to give you the confidence to handle minor eye irritations at home with simple, safe, and effective techniques. We want to do this safely and effectively, always keeping your cat's comfort and well-being as our top priority. We'll cover simple remedies that bring comfort to your feline friend, easing their discomfort and helping them feel more relaxed. And these remedies can stop small issues from becoming big problems, potentially saving you a trip to the vet and preventing unnecessary stress for your cat. This isn't about replacing your vet. They are an essential part of your cat's healthcare team. It's about being proactive and informed, empowering you to provide the best possible care for your cat in between vet visits. By learning these basic care techniques, you'll strengthen your bond with your cat, showing them that you're there to care for them when they need it most. And you'll build trust with your cat, creating a deeper connection based on mutual care and understanding. Think of this as another skill in your cat care toolkit, adding to your ability to provide comprehensive care for your feline companion. Just like trimming claws or finding their favorite scratch spot, it's another way to enhance their well-being and quality of life. We'll break down what causes eye issues in cats, exploring common culprits and potential underlying conditions. We'll cover how to spot them early on and what you can do to provide immediate relief and support. Remember, a calm and confident guardian helps create a calm and confident cat. Your demeanor can significantly impact your cat's stress levels. Let's get started and help your feline friend feel better, empowering you to take proactive steps in their eye care and help them see clearly again, ensuring they can fully enjoy their surroundings and interact with the world around them. You've got this, and I'm here to guide you every step of the way, providing you with the knowledge and support you need. Let's demystify what's happening when your cat has an eye infection. The most common culprit is conjunctivitis, pink eye, and inflammation of the membrane lining the eyelids. Causes range from dust or pollen to viral or bacterial infections, like feline herpes virus or calcivirus. Watch for squinting, redness, swelling, or discharge, clear, yellow, or green. Pawing at the face or sneezing can also signal an issue. Mild cases stem from irritation or infection, but ignoring symptoms can risk your cat's vision. Knowing these basics helps you spot the difference between harmless sleep and a real problem. Your attention is the first step to helping your cat heal. Let's move on to what you can do at home. One of the best home remedies, the warm compress. It's simple. Warmth soothes inflammation and helps loosen crusty discharge. The gentle heat softens debris, making it easy to wipe away without hurting your cat. It also boosts blood flow, supporting natural healing. While it won't cure infections, it brings comfort and keeps the eye clean. A warm compress is your first gentle step to help your cat feel better. Is your feline friend experiencing some discomfort around their eyes? A warm compress can provide soothing relief. Here's how to do a warm compress, step by step. We'll guide you through the process to ensure it's a comfortable and effective experience for both you and your cat. First, gather a clean, soft cloth. Make sure it's free of any detergents or fragrances that could irritate your cat's delicate skin. A soft cotton cloth works best. You'll also need a bowl of warm, not hot, water. Test it on your wrist, just like you would for a baby's bath. The water should feel comfortably warm, not scalding. Prepare your space and have everything ready before bringing your cat over. This will help minimize stress and make the process smoother. A calm environment is key. Gently and calmly, bring your cat over to the prepared area. Avoid sudden movements or loud noises that could startle them. Choose a calm moment, maybe after a nap, when your cat is already relaxed and receptive. This will increase the likelihood of a positive experience. Gently hold your cat in your lap, providing a sense of security and comfort. A gentle touch can go a long way in reassuring your feline friend. If needed, and if your cat is particularly squirmy, wrap them snugly in a towel, kitty burrito style for safety, and to prevent scratching. Make sure they can still breathe comfortably. Speak softly and soothingly to keep them relaxed throughout the process. Your voice can be a powerful tool in calming your cat's nerves. Dip the cloth in the warm water, and then wring it out thoroughly so it's damp, but not dripping wet. Excess water can be uncomfortable for your cat. Before applying, let your cat sniff the warm cloth, allowing them to familiarize themselves with the scent and temperature. This can help reduce anxiety. Then gently hold it against the closed eyelid for approximately 30 seconds to a minute. This allows the warmth to penetrate and soothe the area. Rewarm the cloth as needed to maintain a consistent temperature. The warmth is what provides the therapeutic benefit. Afterward, very gently wipe from the inner corner of the eye outward, following the natural direction of tear flow. This helps remove any discharge or debris. Be sure to use a clean part of the cloth each time you wipe to prevent spreading any potential infection or irritation. Hygiene is crucial. Repeat this process 2 to 3 times a day while the eye is irritated, or as directed by your veterinarian. Consistency is key to seeing improvement. Always use a fresh, clean cloth or cotton ball for each wipe to minimize the risk of contamination and further irritation. Be patient and gentle throughout the entire process. Never rush or force anything. Your cat will appreciate your calm and reassuring approach. End each session with a treat and plenty of praise to make it a positive experience for your cat. Positive reinforcement will make future treatments easier. Consistency, patience, and kindness make all the difference in providing effective and stress-free care for your beloved feline companion. Remember to consult your vet if the irritation persists. After the warm compress, it's time to clean the eye with sterile saline solution. Saline matches your cat's natural tears, making it gentle and non-irritating. It safely flushes away debris and discharge, helping the eye heal. Always use store-bought sterile saline made for eyes, never homemade. Don't touch the dropper tip to anything, including your cat's eye, to keep it sterile. Saline doesn't treat infection, but it keeps the eye clean and comfortable. A clean eye is less likely to be pawed at or further irritated. This simple step supports your cat's recovery. Ready to use saline? Here's how. Have your saline and clean cotton balls or gauze ready. Hold your cat securely, using a towel wrap if needed. Gently tilt their head up and pull down the lower eyelid to make a pocket. Without touching the eye, squeeze in 2 or 3 drops of saline. Your cat will blink, spreading the solution and flushing out debris. Wipe away excess moisture and discharge from the inner corner outward, using a fresh cotton ball each time. Repeat for the other eye if needed, always using new supplies. Keep the process gentle and calm. Finish with praise and a treat. When it comes to providing care for your feline friend at home, especially when dealing with something as sensitive as eye treatments, success often hinges on a few key elements. It's not just about the medicine or the technique, It's about creating an environment and a mindset that allows both you and your cat to navigate the process with as little stress as possible. Success at home comes down to the 3 C's: calm, confident, and consistent. These 3 attributes will not only make the treatment process smoother, but will also strengthen the bond you share with your cat. Your cat senses your mood. They are incredibly perceptive creatures, finely tuned to pick up on subtle cues in your behavior and emotional state. So stay relaxed and steady. If you approach the situation with anxiety or frustration, your cat will likely mirror those feelings, making the treatment more difficult. Take a breath, center yourself before you begin. Move gently, avoid sudden or jerky motions that could startle your cat, and reassure your cat with your voice. A calm, soothing tone can work wonders in easing their anxiety. Be confident in your actions. Show your cat that you know what you're doing and that they can trust you. Hesitation can make your cat nervous. They can sense uncertainty, which can amplify their fear or resistance. Prepare your supplies, have everything you need within easy reach, and know your steps before you start. This will minimize fumbling and keep the process as quick and efficient as possible. Consistency is key. Cats thrive on routine. Treat the eye 2 to 3 times daily, as directed by your veterinarian. At the same times, if possible. This predictability can significantly reduce anxiety. Routine helps your cat know what to expect, creating a sense of security, and reduces stress. A stressed cat is much harder to treat. Some cats adjust quickly, accepting the treatment with minimal fuss. Others need time. Be patient. It may take days or even weeks for your cat to fully acclimate to the process. If things aren't going well, if your cat is becoming overly distressed or resistant, pause and try again later. Don't push it to the point of trauma. Never force the process. Forcing a cat will only erode trust and make future treatments even more challenging. Trust is everything. A trusting cat is more likely to cooperate, even when they're uncomfortable. Always end on a positive note, regardless of how the treatment went. Even if progress is small, focus on the positive aspects of the interaction. A gentle touch, a soft stroke behind the ears, and a treat. If your cat is allowed to have them, reinforce that you're their partner in health. Show them that you're there to help them feel better, not to cause them harm. Patience and kindness build lasting trust. These qualities will not only make eye treatments easier, but will also deepen the bond you share with your beloved feline companion. Home care is great for mild cases, but know when to call your vet. If symptoms don't improve in 24-48 hours or get worse, it's time for professional help. Thick yellow or green discharge, blood, cloudiness, or a closed eye are red flags. Major pain, hiding, not eating, or visible injury means you need a vet right away. Kittens, seniors, or immune-compromised cats should see a vet at the first sign of trouble. Your vet has the tools and treatments to resolve serious issues. Knowing when to call is just as important as home care. As we wrap up, remember your vital role in your cat's life. Managing minor eye issues shows your commitment and deepens your bond. Make daily check-ins part of your routine. Look at their eyes, coat, and behavior. Early detection leads to better outcomes. Your vet is your partner. Never hesitate to ask questions or seek advice. Building trust with your vet is as important as with your cat. Move forward with calm confidence and the skills you've learned. You know when to treat at home and when to call for help. This is what being a true cat guardian is all about. Keep learning, keep caring, and keep that bond strong. Hey, cat people! Jackson Galaxy here, ready to dive into a topic close to every cat lover's heart. Let's talk about something every cat parent faces. Those moments when you notice something just isn't quite right with your feline friend. Maybe it's eye gunk, that crusty buildup that can sometimes appear. Or perhaps you've noticed squinting, a subtle sign that something might be irritating your cat's eye. Or redness in your cat's eye, a clear indicator of potential inflammation or discomfort. It's tough to see our cats uncomfortable, and our first instinct is always to help them feel better as quickly as possible. But sometimes the best first step is a gentle, natural remedy, a way to soothe and alleviate minor irritations without overwhelming your cat. Think of things like chamomile, known for its calming and anti-inflammatory properties, or green tea, which contains antioxidants that can help soothe irritated tissues. These aren't miracle cures, and it's important to have realistic expectations about what they can achieve. But for minor irritations, they can be incredibly soothing and safe, offering your cat some much-needed relief. This guide is about empowering you with simple, effective ways to help your cat at home, providing you with the knowledge and tools to address those everyday eye issues. We'll cover what to look for, helping you identify the signs that warrant gentle home care. We'll explore how to prepare these gentle washes, ensuring you're using the right concentrations and techniques, and crucially, how to apply them so your cat feels safe, minimizing stress and maximizing cooperation. Remember, this is about reducing stress and building trust, creating a positive experience for both you and your cat. We're not replacing your vet. They are essential for diagnosing and treating serious conditions. We're just offering supportive care for mild issues, providing comfort and relief in between vet visits. Think of it like cleaning a small scratch at home. You can handle minor issues, but for anything serious, anything that looks infected or causes significant pain, you go to the doctor. These remedies are for minor redness, the kind that might appear after a long nap or a bit of dust in the eye. Slight weeping, a small amount of clear discharge that doesn't seem to bother your cat too much, or a bit of crust you want to gently clean away, making sure your cat's eyes are clear and comfortable. Let's learn how to be our cat's best advocate and comforter, providing them with the gentle care they deserve. This is about deepening your connection and showing your cat you're always there for them, ready to offer comfort and support. We'll walk through every step so you feel confident and your cat feels loved, safe, and secure in your care. Let's begin this journey of gentle eye care for our feline friends. First, let's identify what we're dealing with. Cat eye infections, conjunctivitis, are common, especially in kittens or multi-cat homes. Causes range from dust and allergies to viruses or bacteria. Watch for redness, swelling, a visible third eyelid or discharge, clear, yellow, or green. Squinting, pawing at the face, or changes in behavior are signs your cat needs help. If symptoms are severe, persistent, or worsen, call your vet. Our natural approach is for mild cases only. Your observation skills are key. Let's talk chamomile, a gentle giant in the world of natural remedies. It's a remedy that's been cherished for generations. Chamomile is widely known and celebrated for its calming and anti-inflammatory properties. It's a natural powerhouse that offers a multitude of benefits. These properties make it perfect for soothing red, swollen, and irritated cat eyes. It's a gentle solution for a sensitive problem. It gently reduces puffiness and redness, bringing comfort to your feline friend. The soothing effect is almost immediate, and its mild antiseptic qualities help cleanse the affected area, preventing further irritation and promoting a healthy healing environment. While chamomile isn't a strong antibiotic, it's a wonderful support for the body's natural defenses. But for minor irritation, it effectively supports the eye's natural healing process, encouraging a swift and comfortable recovery. Its pain-relieving qualities help your cat feel better, reducing discomfort and promoting relaxation. This allows the eye to rest and heal undisturbed, so leave the eye alone to heal. The true beauty of chamomile lies in its gentleness, making it a safe and effective option for your beloved cat. No harsh chemicals or worrying side effects, just a simple flower with centuries of trusted healing tradition behind it. The process of brewing, carefully cooling, and gently applying chamomile tea is more than just a treatment. It's a ritual of care and connection between you and your feline companion. The delicate scent is calming and therapeutic for both you and your cat, creating a peaceful environment. This isn't just about providing physical relief from discomfort. It's also about offering emotional comfort and reassurance to your furry friend during a vulnerable time. You're reinforcing trust and strengthening the bond you share. You're providing comfort in a loving, hands-on way, showing your cat just how much you care. Using chamomile is a holistic approach to pet care, addressing not just the physical symptoms, but also soothing both body and spirit, promoting overall well-being for your cherished companion. That's what true cat guardianship is all about, providing comprehensive care that nurtures every aspect of your cat's life. Let's see how to use it so you can bring this gentle healing power into your cat's life. Is your feline friend experiencing some discomfort with their eyes? Perhaps you've noticed some discharge, redness, or excessive blinking? Ready to help your cat feel better and get those sparkling eyes back? Here's a gentle and natural remedy, a step-by-step guide on how to use chamomile tea safely to soothe your cat's irritated eyes. This simple solution can provide relief and comfort to your beloved pet. The first and most important step is to ensure you're using the right kind of chamomile tea. You'll want to use a pure chamomile tea bag, no added flavors, perfumes, or caffeine. These additives can be harmful to your cat's delicate eyes, so stick to the basics for a safe and effective treatment. Now, let's brew the tea. Steep one bag in a cup of boiling water for approximately 5–10 minutes. This allows the beneficial properties of the chamomile to infuse into the water, creating a soothing solution. Once steeped, it's crucial to let it cool completely to room temperature. Never ever use warm or hot tea on your cat's eyes. The temperature should be comfortable and gentle. Test the temperature with your finger to be absolutely sure it's safe. Hygiene is paramount when dealing with eye care. Prepare sterile cotton balls or lint-free pads. This will prevent any further irritation or infection. Dip a cotton ball in the cooled tea, ensuring it's fully saturated, then gently squeeze out any excess liquid. You want the cotton ball to be damp, not dripping. With a soft touch, gently wipe from the inner corner of the eye outward, following the natural direction of tear flow. This helps to remove debris and soothe the area. To prevent cross-contamination, use a fresh cotton ball for each wipe and each eye. Never double-dip the same cotton ball, as this can spread bacteria. Before you begin, create a calming environment for your cat. Approach your cat calmly, choose a quiet spot where they feel safe and secure, and speak softly to reassure them. When handling your cat, remember to be gentle. Don't restrain forcefully. A calm and relaxed cat is more likely to cooperate with the cleaning process. For optimal results, cleanse the eye 2 to 3 times a day for a day or two, or as needed. Consistency is key to seeing improvement. Keep a close watch for improvement. If things don't seem to get better, or if they worsen, within 24–48 hours, it's essential to call your vet for professional advice. Quick recap. Let's run through the steps one more time. Brew steep pure chamomile tea in hot water, allowing it to fully infuse. Cool. Let it reach room temperature, ensuring it's safe and comfortable for your cat. Prepare. Use sterile cotton balls to prevent infection and ensure a clean application. Cleanse. Wipe gently from the inner corner outwards, using one direction and a fresh cotton ball for each wipe. Monitor. If there's no improvement in your cat's condition, don't hesitate to contact your vet for further guidance and treatment. Now let's talk green tea. Green tea is packed with antioxidants, catechins, that help fight cellular stress and support healing. It's also anti-inflammatory and mildly antibacterial, with astringent tannins that gently dry watery discharge. If your cat's eye is weepy and watery, green tea can help reduce excess fluid and keep the area comfortable. Use green tea for clear, watery discharge, chamomile for redness and swelling. You can alternate between them if needed. The goal: gentle, effective care tailored to your cat's symptoms. Understanding each tea's strengths helps you make the best choice for your cat. That's the mark of a knowledgeable cat guardian. Let's see how to use green tea safely. Using green tea is similar to chamomile with a few key points. Use a plain caffeinated green tea bag. No added flavors or herbs. Brew one bag in a cup of boiling water for 3–5 minutes. Let it cool completely. Test on your wrist to ensure it's not warm. Prepare sterile cotton balls or pads. Dip a cotton ball in the cooled tea, squeeze out excess, and gently wipe from the inner corner outward. Use a fresh cotton ball for each wipe and each eye. Approach your cat calmly in a quiet space. Your calm energy helps your cat relax. Cleanse 2 to 3 times per day, watching for improvement. Never reuse cotton balls. Hygiene is critical. If symptoms persist or worsen, stop and call your vet. Safety and observation are your top priorities. No matter which tea you use, follow these universal rules. Be gentle. No scrubbing or pressure, just a light touch. If your cat resists, stop and try again later. Never force it. Hygiene is non-negotiable. Wash your hands before and after, use fresh cotton balls for every wipe, and make a new batch of tea daily. Observe closely. Is redness decreasing? Less discharge? If not, or if things worsen, stop and call your vet. Choose a quiet time and place for treatment. Afterward, reward your cat with treats or gentle pets to create a positive association. The goal is a calm, bonding ritual, not a stressful event. Respect boundaries, maintain hygiene, observe carefully, and prioritize comfort. That's how you make this remedy safe and loving. Your cat's well-being always comes first. Let's talk about knowing your limits. Sometimes, the best care is knowing when to call the vet. Natural remedies are great for mild issues, but not a substitute for your vet. Call your vet if discharge is thick, yellow, or green. This signals a bacterial infection needing prescription meds. Severe pain, constant squinting, or extreme sensitivity to light are emergencies. If your cat is pawing frantically, hiding, or not eating, don't wait, get help. Recurring or both eye problems may signal a bigger issue. If there's no improvement after 24–48 hours of gentle cleansing, stop and call your vet. Your vet is your partner in your cat's health. Being a good cat guardian means knowing when to ask for help. Use these remedies for mild irritation, but escalate at the first sign of serious trouble. Your cat is counting on you. We've covered gentle chamomile and green tea remedies for minor cat eye issues. You now know how to spot problems, apply natural care, and when to call the vet. This knowledge empowers you to be a proactive, hands-on caregiver. Caring for a cat is about more than food and litter. It's about noticing the small details. By reading your cat's signals, you can catch problems early. A gentle chamomile wash at the first sign of redness is proactive care. Trust your instincts. You know your cat best. Every act of care builds trust and strengthens your bond. Our goal: long, happy, comfortable lives for our cats. Combine gentle home care with responsible vet visits for the best results. Thank you for being a compassionate cat guardian. Now go give your cat a slow blink. They know you've got their back.
Hey, cat lovers! Welcome back to the channel. Today, I want to help you keep your cat's eyes healthy and infection-free. If you've ever worried about your kitty's peepers, stick around. These simple tips will protect your furry friend and keep those eyes sparkling. Let's start with why your cat's eye health matters so much. Cats explore the world with their eyes, just like we do. Healthy eyes mean your cat can spot a toy from across the room, chase sunbeams, and stay out of trouble. But eye infections? They can cause discomfort, blurred vision, or even long-term damage if ignored. Keeping their eyes clear and bright is a big part of making sure your cat feels their best every day. Tip number 1. Keep your cat's environment clean. Dust, allergens, and even strong cleaning chemicals can irritate those sensitive eyes. I like to vacuum and dust regularly, especially around my cat's favorite spots. I also make sure their bedding is washed often and avoid spraying perfumes or harsh cleaners near where they hang out. A clean space is a safe space for you and your cat. Tip 2. Regular grooming goes a long way. Brushing your cat, especially around their face, helps keep fur and dirt out of their eyes. Some cats are more prone to eye gunk, so I use a gentle, damp cloth to wipe away any buildup. Not only does this keep their eyes clear, but it's also a great bonding moment with your kitty. Tip 3 is to monitor your cat's eyes regularly. Make it a habit to check for redness, discharge, or squinting. Early signs of infection are easier to treat, and you'll catch little issues before they become big problems. If anything looks off, don't hesitate to reach out to your vet. Tip 4. Keep your cat hydrated. Fresh water is surprisingly important for healthy eyes. I always make sure my cat's bowl is filled with clean water and I change it out daily. Hydration helps maintain tear production and keeps their whole body, including their eyes, in top shape. Tip 5. Avoid exposing your cat to allergens. Pollen, dust, and strong scents can all trigger irritation. During allergy season, I keep windows closed and run an air purifier when needed. It helps my cat breathe easier and keeps their eyes clear. Tip 6. Don't skip those vet checkups. A quick eye exam during your cat's routine visit can catch problems early. Vets can spot things you might miss, and they'll give you the best advice for caring for your cat's unique needs. So, those are my top tips for keeping your cat's eyes healthy and happy. Just a little effort every day can make a huge difference for your furry friend. If you found these tips helpful, hit that like button, leave a comment with your own cat care tips, and don't forget to subscribe for more advice on keeping your pets healthy and happy. Thanks for watching, and give your cat a little extra love today.
Hey cat people, welcome back to the channel. I'm Dr. Emily Carter, and today we're going to be talking about something near and dear to every cat lover's heart, their cat's eyes. Let's talk about your cat's eyes. Those captivating orbs that seem to hold so much mystery and emotion. Those beautiful, mysterious orbs, sparkling with curiosity and intelligence. They're more than just pretty features. They're a window into your cat's soul. They are the key that reveals so much about their mood and trust in you. That gentle, slow blink? That's pure kitty affection right there. Their eyes are a huge part of their confidence and sense of security. When a cat feels safe and secure, their eyes are bright, alert, and full of life. They're taking in the world around them, feeling in control of their environment. But when something's wrong with their eyes, even something seemingly small, it can throw their whole world off balance. Imagine not being able to see clearly, or experiencing pain and discomfort in your eyes. It would be incredibly disorienting and frightening, right? As their guardians, the people they depend on for everything, it's our job to notice when things aren't right, to be observant, to pay attention to the subtle cues that our cats give us, and to act quickly when we suspect something is amiss. Cats rely on their vision for everything. It's one of their primary senses, helping them navigate their surroundings, identify threats, and interact with the world. From stalking toys, honing their hunting skills, and engaging in playful behavior, to giving you that slow, loving blink, a sign of complete trust and affection that melts our hearts every time. Even minor eye problems, things that might seem insignificant at first glance, can make them feel vulnerable and stressed. Because when their vision is compromised, their sense of security is shaken. That's why being a proactive cat parent matters. It's about taking responsibility for their well-being and being vigilant about their health. Spotting subtle changes, those little hints that something might be off, like a weepy eye, a slight discharge, or excessive blinking, or redness, inflammation, or any other unusual appearance, shows your cat you're in tune with their needs. It tells them that you're paying attention, that you care, and that you're there for them. This builds trust and strengthens your bond, because when they know you're looking out for them, they feel safe, secure, and loved. So let's dive into what you need to know about cat eye infections and other common eye problems. We'll equip you with the knowledge to be the best cat parent you can be. We'll cover how to spot the signs, the telltale indicators that something isn't quite right with your cat's eyes. We'll discuss why your vet is your best ally in these situations, and why professional diagnosis and treatment are so crucial. And we'll explore what treatments can help alleviate their discomfort and get them back to their happy, healthy selves. Because at the end of the day, what truly matters is the well-being of our feline companions. We all want a happy, healthy cat with plenty of mojo, a cat who's full of energy, confidence, and zest for life. So let's get started on this journey to understanding your cat's eyes and ensuring their optimal health. The first step in ensuring your feline friend lives a happy and healthy life is knowing when something's wrong. Recognizing the subtle signs of illness or discomfort in your cat can be crucial for early intervention and treatment. As responsible cat owners, we need to be vigilant and observant of any changes in their behavior or physical appearance. Redness in the white of the eye or swollen eyelids are significant indicators that something isn't right. These symptoms suggest inflammation or irritation, which could be caused by a variety of factors, including infection, allergies, or injury. This is a big warning sign that warrants immediate attention. Don't dismiss it as a minor issue. It could be the first sign of a more serious underlying problem. Watch for unusual discharge, clear and watery, which might indicate allergies or a mild viral infection. Keep a close eye on the consistency and color of any discharge coming from your cat's eyes. Or if you notice thick and yellow-green discharge, this is a strong indication of a bacterial infection that requires veterinary treatment. If the discharge crusts over and seals the eyelid, preventing your cat from opening their eye comfortably, your cat is in real discomfort and needs immediate relief. This can be incredibly painful and distressing for your feline companion. Squinting, which is often a sign of pain or light sensitivity. Holding an eye shut completely, trying to avoid any further irritation. Or pawing at the face, attempting to relieve the discomfort around their eye, are all clear signs of pain and should never be ignored. These behaviors indicate that your cat is experiencing significant distress. Sometimes you'll notice your cat hiding, seeking solace in dark and quiet places, eating less than usual, showing a decreased appetite, or acting lethargic, displaying a general lack of energy and enthusiasm. Eye infections can often be linked to upper respiratory infections, creating a combination of symptoms. So sneezing or a runny nose may also appear alongside the eye issues. This is because the same viruses or bacteria can affect both the respiratory system and the eyes. If you see more than one of these signs, it's crucial to take action. Your cat is sending an SOS, a clear signal that they need your help and attention. Don't ignore it. Your quick action, such as scheduling a vet appointment, can make all the difference in their recovery and comfort. That's what being a great cat parent is all about. Being attentive, responsive, and ensuring your furry friend receives the care they need to thrive. Have you noticed your feline friend exhibiting some unusual signs around their eyes? Perhaps a bit of redness, excessive tearing, or even a discharge that wasn't there before? These could be indicators of an underlying issue that needs prompt attention. As loving cat owners, it's natural to feel concerned when we see our beloved pets in distress. Recognizing these early warning signs is the first step in ensuring their well-being. When you spot these symptoms, resist the urge to self-diagnose or reach for those tempting home remedies you might find online. Instead, your immediate reaction should be to call your vet. A quick phone call can set the wheels in motion for proper diagnosis and treatment. Your veterinarian's expertise is crucial in these situations. They have the knowledge and tools to accurately assess the problem and provide the best course of action for your cat's specific needs. Think of your vet as your cat's health MVP, the most valuable player in their healthcare team. They are the trained professionals equipped to handle any health challenges your cat may face, especially when it comes to something as delicate as their eyes. The tricky thing about eye problems in cats is that they can often appear quite similar on the surface, yet stem from vastly different underlying causes. What might seem like a simple irritation could actually be a sign of something more complex. The culprit could be a bacterial infection, a viral invader, a physical injury to the eye, or even a symptom of a systemic illness affecting the entire body. These systemic issues can manifest in various ways, and eye problems can sometimes be an early indicator. With so many potential causes, only a qualified veterinarian has the expertise to accurately diagnose the real issue behind your cat's eye problems. They can differentiate between various conditions and pinpoint the exact cause, and once they've identified the problem, they can choose the most appropriate and effective treatment plan tailored to your cat's specific condition. This ensures that your cat receives the right medication and care for a speedy recovery. During the examination, they'll carefully examine your cat's eyes, looking for any abnormalities or signs of damage. This thorough assessment is crucial for an accurate diagnosis. They might even use a special dye like fluorescein to check for any tiny scratches or abrasions on the surface of the eye that might not be visible to the naked eye. This dye helps highlight any damage, allowing for a more precise evaluation. Based on their findings, your vet will then decide on the safest and most effective medication to address the specific issue affecting your cat's eyes. They'll consider factors like your cat's overall health and any potential side effects of the medication. Remember, using the wrong treatment can potentially make things significantly worse, leading to further complications and discomfort for your feline companion. This is especially true if there's an underlying scratch or ulcer on the cornea, the clear front surface of the eye. Applying the wrong medication to a damaged cornea can cause severe irritation and delay healing. Therefore, it's essential to trust your veterinarian to create a comprehensive treatment plan that is specifically tailored to your cat's individual needs and condition. This personalized approach ensures the best possible outcome for your furry friend. This isn't just about fixing the immediate infection or addressing the obvious symptoms. It's about providing holistic care that considers all aspects of your cat's well-being. It's also about effectively managing any pain or discomfort your cat may be experiencing and implementing preventative measures to minimize the risk of future eye problems. A proactive approach is key to maintaining your cat's long-term eye health. Building a strong and trusting relationship with your veterinarian is paramount. Open communication and a collaborative approach are essential for ensuring the best possible care for your cat. They are your trusted guide and invaluable resource in navigating the path to a long, happy, and healthy life for your beloved cat. Their expertise and guidance are essential for ensuring your cat's well-being. And a crucial reminder, never, ever use old medications or medications prescribed for another pet or person. Medications expire and can become ineffective or even harmful, and using the wrong prescription can have serious consequences. Your vet is your partner in your cat's healthcare journey. Don't hesitate to lean on their expertise and seek their advice whenever you have concerns about your cat's health. Remember, quick action and a strong teamwork approach between you and your vet will always lead to the best possible outcomes for your feline companion. Early intervention is often key to successful treatment. Ultimately, your cat is counting on you to make the right call and seek professional veterinary care when they need it most. They depend on you to be their advocate and ensure their well-being. If your vet diagnoses a bacterial infection, they'll prescribe antibiotic drops or ointment. Use only what your vet gives you. Different bacteria need different meds. Applying eye meds can be tricky, but a calm, gentle approach helps. Swaddle your cat in a towel, tilt their head, and apply the drops or ointment as directed. Always reward your cat with treats and praise. Stick to the schedule. Don't skip doses or stop early, even if the eye looks better. Incomplete treatment can cause the infection to come back stronger. Keep the applicator clean and never touch it to your cat's eye. Hygiene and consistency are key to a quick recovery. Follow your vet's instructions for the best results. Sometimes a virus, like feline herpes virus, is the real culprit. Antibiotics won't help here. Your vet may prescribe antivirals or supportive care. Stress can trigger viral flare-ups, so keep your cat's environment calm and comfortable. Clean their eyes and nose gently, and use a steamy bathroom to ease congestion. Your vet might recommend L-lysine supplements to help manage flare-ups. The goal is to support your cat's immune system and keep them comfortable. With the right care, most cats bounce back from viral infections. Eye infections hurt. Managing pain is essential for healing. Your vet may prescribe anti-inflammatory drops or ointments for quick relief. A cozy space helps your cat rest and recover. Dimming the lights can ease eye sensitivity. Comfort and pain relief speed up recovery. Your cat will thank you for making them feel safe and cared for. Ointments and salves stick to the eye longer than drops, delivering steady medication. Apply them by gently pulling down the lower eyelid and squeezing a small ribbon into the pouch. Don't let the tube touch the eye. Blinking spreads the ointment naturally. Some blurriness is normal right after application. Follow your vet's instructions for how much and how often. Finish the full course, even if the eye looks better. These salves are powerful tools for healing. Once you have your vet's plan, your job is to follow it exactly. Give every dose on time. Set reminders if needed. Keep your cat's face clean with a soft, damp cloth, using a fresh one for each eye. Clean bowls, bedding, and litter boxes to reduce germs. For cats with recurring issues, manage stress and provide plenty of enrichment. Multiple cats? Make sure there are enough resources to prevent conflict. Don't skip the follow-up visit. Your vet will check that the infection is truly gone. Ask questions and discuss long-term prevention. Supplements like L-lysine may help some cats. Consistent care keeps your cat's eyes healthy. Prevention is just as important as treatment. Dealing with a sick cat is tough, but you've got this. By spotting problems early and working with your vet, you're giving your cat the best chance at a full recovery. Most eye infections clear up quickly with proper care. Soon you'll see those bright, happy eyes again. This experience can deepen your bond. Your cat learns you're their safe place. Trust built during care lasts a lifetime. Stay vigilant and cherish those slow blinks. You now know what to look for and how to act. With your love and knowledge, your cat's future is bright and clear. That's a future worth fighting for.